Hi and welcome to the Spinal Institute's 3 Steps to a Pain-Free Neck. What you're going to learn in this DVD are the 3 steps to removing your neck pain and dealing with any pinched nerve symptoms down your arm, across your shoulders, if you have any. We're going to show you this safe, effective and simple method for you. The first step we're going to look at is removing the causes of your neck pain. The second step, we're going to deal with the pain more directly. And then the third step, I'm going to show you how you can maintain your pain-free neck and show you some tips and techniques that you can do on a daily basis. Now the first step is, as I say, removing the causes of your neck pain. Because you've probably never even thought about this, but it is vital that you remove the causes of your neck pain. Because if you do not, you can never expect to be pain-free permanently because you're continually hurting your neck. And this is what the majority of people do. They continually hurt their neck, they don't know what's causing the pain, but then they'll have neck pain, they'll go to a practitioner, they'll get better for a while, but then the neck pain will mysteriously come back. We're going to show you how to address the major causes of neck pain and eliminate them so your neck can finally start to heal. Now, let me just illustrate this point a little more clearly for you. Because if you don't remove the causes, well, this is what happens. Here's Ralph. Now, Ralph, he suffers from neck pain. He suffers from neck pain because I hit him across the back of the neck all day, every day, thousands of times a day with the baseball bat. Now, as much fun as it is for me, and quite therapeutic if I must say, but Ralph doesn't like it because he doesn't like to suffer from neck pain. So let me ask you this. If you were to help his neck pain, what would you recommend? Chiropractic, acupuncture, massage, Advil, muscle relaxants, cortisone? Get me to stop hitting him with a baseball bat across the neck? Well, that's not a bad idea, is it? You see, the cause of his neck pain is me hitting him with this baseball bat across the back of the neck, right? And if he went and spent thousands of dollars on treatments or medications, while I'm still hitting him across the back of the neck with the baseball bat, well, he's never going to get better, is he? He might feel better for a little while, but as long as I am damaging his neck with a baseball bat, he's going to continue to have pain. So the first and foremost, we must remove the cause, me hitting him with the baseball bat. But this is probably what you've been doing for years. And it's what the majority of people do. They're never even taught what the causes of the neck pain are. They'll just go and get therapy, get better, and they'll be in this recurrent bouts of neck pain. They'll be good for a while, and then suddenly they've got neck pain again. I'm going to show you what are the major causes of your neck pain first and foremost. It is the most important step in the 3-step method if you want to become pain-free permanently. Okay, so let's get started. So, let's remove the causes of neck pain. So what is the major cause or causes of neck pain? Well, it might look something like this to you. When you're in front of the computer, or driving, or texting. It's called the forward head posture, this. That is the major cause, the most common cause of all neck pain, the forward head posture. You must remove this from your daily life to ever have a pain-free neck permanently. The forward head posture puts enormous strain on your neck. Now, so let's just go back a step. What is correct posture? Correct posture is where your head is atop your spine. It's not out in front. In other words, you get that feeling of standing tall, walking tall, and sitting tall, feeling elongated through the spine. A little hint for you. If you dropped a stone from your chin, it should drop onto your chest. It should drop onto your chest, not onto the floor. When you're in correct posture, if you dropped a rock from your ear, it should land on top of your shoulder, not onto the floor. So that is correct posture. But the thing is, when you get into that forward head posture, now your head weighs around about 12 pounds. Every inch that your head translates forward from that correct posture creates an extra 10 pounds of weight for your neck muscles and your neck structures. So every inch, now it's not uncommon for us to be in the clinic to see people with their neck translated 2 to 3 inches in front. That's an extra 20 to 30 pounds on top of their already 12-pound head. That's a 42-pound head. So just imagine if I asked you to hold a bag of groceries that were 42 pounds. Well, you wouldn't last a few minutes, would you? Your arms, your muscles would be aching. but that's what you ask of your neck structures when you are like this in front of the computer or driving in a forward head posture. The forces are enormous. Now these muscles get very sore, of course, just like your arm muscles would. So apart from that, these muscles also, if you do this long enough, will have chronic imbalances. You then get tight, weak muscles here, long, tight muscles at the back. You get these major muscular imbalances. Add to that, you can then get trigger points in the muscles. Now, trigger points are little painful points within the muscles that can be very painful as well. Worse than that, they can then refer pain, and that can give you suboccipital headaches, headaches across the eye, and I'm sure some of you watching this are already familiar with these headaches. These trigger points refer pain also into the shoulders, into the arms. Now, that's your soft tissues. But let's have a look at what happens in the forward head posture, what you're doing to your spine, because it gets worse. Now, when you're in this position here, your lower cervicals, now, look at my hands here. Imagine my hands are your vertebrae. Imagine between my hands there's a balloon. Now, if I do this, the balloon will bulge out this way, right? That balloon represents what's happening with your disc. The inner part of the disc, when it's in flexion, migrates backwards. So, if I do this, which is what happens to your lower spine in your cervical area, if I do that, those are now flexing, pushing the disc backwards. Do this long enough and your neck can feel very stiff. If that disc then bulges even further backwards, it can then bulge and press on a nerve, which can then give nerve-related symptoms into your shoulders, into your arms, tingling, numbness or pain. So we need to get that forward head posture out.